Okay, hi, Paul Sakis, Good News Broadcast, Good News Planet, and Pause the World for Peace. And we're going to talk today about important osteoporosis, okay, which affects many, causes more than 8 million fractures worldwide annually. In osteoporosis patients, a fracture is associated with 86% increased risks of future fracture. Okay, this is serious. We're here with Dr. Let me make sure I say your name. Desapri. Hi, how are you?
Correct.
Good.
Hi, Paul. Good. How are you?
All right, good. Somebody, I'm good. I'm good. I don't have a hip fracture, and I don't know
Okay.
if I don't know if I would get a hip fracture more than a woman gets hip fracture because a lot of women and a lot of women I know have gotten hip fractures. Why are women getting hip fractures? Our fractures.
So, yeah, well, thanks, Paul. Good question. You bring up a good point. Women are more preferentially affected by osteoporosis because we have menopause where we lose estrogen, and that increases the risk of a fracture because bone loss happens exponentially at the sites of particularly spine and hip. You bring up a statistic where there's a difference. 1 in 3 women will sustain an osteoporosis-related fracture in their lifetime. That can include a hip fracture, it can include a spine fracture, wrist fracture, forearm, leg fracture, but 1 in 5 men will sustain an osteoporosis-related fracture. We also know that lifespan of women and men are changing, and we're spending a lot more time in the postmenopausal years where we need to achieve and maintain our peak bone mass to prevent those fractures that you mentioned.
I'm going to start with a very probably silly question. Women have to have menopause?
So when we think about, osteoporosis, we achieve our peak bone mass in our teens, our 20s, and then at menopause, we sort of plateau for a little while, and at menopause, we lose bone density. So when we think about fractures, particularly fractures in the postmenopausal years, these are fractures from a standing height or less. These are low trauma fractures. So these are more commonly diagnosed as women age. We also know that falls increase as we age for a variety of reasons. Many times if we fall, we will sustain a fracture. And primarily if women or men have osteoporosis where we know that bone is thin. So osteoporosis is usually misunderstood, but really is a condition of weakening or decreased bone mineral density or bone strength that increases that risk for a fracture. Not every woman needs to have who has a fracture has osteoporosis. However, that really needs to be evaluated if you've had an adult fracture to make sure that you have a risk assessment, a bone mineral density scan, a risk assessment for future fractures. And the reason for that is, like as you mentioned in the beginning, this is serious. So 20% or 1 in 5 women who have sustained an osteoporosis-related fracture will sustain another fracture within the first 5 years. And in the year following, the risk is even higher. And the fractures, as you mentioned, a lot of women with hip fractures. Hip fractures carry significant consequences for pain, decreased mobility, change in independence or daily activities, even lifespan can be affected. So really important to prevent that first fracture. And that's why I'm working here with Amgen to really to promote awareness about osteoporosis and what can be done to prevent and treat the very common condition that it is.
Okay. I'm going to get back and ask a question. All women have menopause. Is that right? Is that a bodily function of
Well,
a woman?
yeah, menopause is a natural event in a woman's life. It can be natural menopause or menopause that occurs, with the loss of ovarian function. It also could be surgical menopause. There's also menopause that can occur due to, a medication, chemotherapy, radiation treatments, et cetera. So a variety of ways that women can enter menopause. Yes, and one of the risk factors for bone loss, and one of the things that you should be asked is, when did you have menopause? Because we know early menopause, whether that's natural or surgical or chemically induced, puts you at increased risk for bone loss. And again, when women are living longer, we need to maintain that bone density and strength so we prevent these fractures that we're talking about.
So I did go to your website, understandop.com, and it was very interesting
Right.
that there's maybe 2 approaches to building a bone strength once again. And please explain those two to us. Or maybe there's more, but those are the
Sure.
ones I understood.
Yeah, thank you for referencing that website. So for postmenopausal women with osteoporosis who may be at risk or want to take a more proactive approach, understandop.com is where you can find more information about treatment options, how to discuss risk and benefit of medication, lifestyle treatment options, and just general information on osteoporosis. And there are many different ways that we can improve bone mineral density and decrease risks of fractures. One is to prevent further bone loss. And the other way is to increase the bone mineral density or increase the new bone that is being built to strengthen the bone that's there. And this is really an individualized approach and really needs to be something that I would recommend women speak with their physicians or a healthcare provider that is educated on the topic to really find the best option to prevent, diagnose, and treat osteoporosis if they have it.
You have some new medicine after probably 10 years of R&D that your company has been involved with. So there's help me with these words, arteriosupportives and anabolics. Anabolics. I probably don't even say them close to how they are pronounced. What are the two differences?
Yeah, so thanks for bringing that up. I think, yes, very exciting in the field of osteoporosis that we have new therapies. I always say it's important to be able to keep up with the demand, particularly as we know, women are aging and osteoporosis is very common yet underdiagnosed, and fractures, are so, are so common and then progressive. And as you mentioned in the beginning, 80% of women who have a fracture and are not treated or diagnosed successfully within 1 year. And that's really something why I'm talking today and trying to raise awareness with Amgen is that we have this treatment gap that we need to close. And so again, when we think about medications, they really work on the way that we think as scientists in bone physiology, either by strengthening or boosting the bone mineral density or preventing bone loss. And that's the names that you use there, the osteoanabolic or bone building agents, or anti-resorptive or prevention of further bone loss. And so that's really, some of the mainstay things that we talk about. Again, the treatment needs to be very individualized. And I would highly recommend postmenopausal women speak with an educated clinician on talking about the risk benefit and what can work for them. Again, with the end goal being that we are diagnosing, preventing, and treating osteoporosis.
So just another wonderment here. So, for example, with this therapy or medicine, bone strengthening, even for men, I was chondroitin and glucosamine and or other kinds of things. Do we have similar bone structure, a man and a woman, or a woman's density, as you say, is more, or is it more weakened than a man as they get older?
Yeah. Well, so it all starts with sort of hormones and gender differences in terms of our peak bone mass, and then how much acceleration of bone loss happens at the time of menopause. Testosterone, estrogen, all these hormones play a role. But every bone in our body is made up of two different types of bone: cortical bone and trabecular bone. So men and women have the same components. Sometimes, again, the strength or the structures of those bones in different areas of the body are different. And so, yes, I mean, osteoporosis also affects men, as you've mentioned here. So, and in fact, we know that men who have a hip fracture, the consequences for lifespan and things like that are more significant or serious. So, yes, there are options. Sure, there are lifestyle options, and there are therapies in the nutritional space, and those things are all very important. But what's really important to understand is that when you have osteoporosis, which is advanced bone loss, things like nutritional and calcium play a role as a building block to reduce the risk of fractures. And we know that our FDA-approved medications do that significantly.
All right, and you're the owner of Bone and Body Women's Health, the Midlife Women's Health Medical Practice. Where is that located?
So I am. I'm the founding physician of Bone and Body Women's Health, which is a menopause and osteoporosis bone health practice in the northern suburbs of Chicago.
Okay. Thank you so much. I appreciate the information, and congratulations to the company coming up with therapies that are helping women by far. Appreciate the interview. Thank you.
Absolutely. Thank you, Paul.
Okay, take care. Bye-bye.